I'm Nagengast. I'm a source water protection extension educator out of UNL. I also do a lot of work with the University of Nebraska Medical Center on the health impacts of water quality, as well as work with the Nebraska Department of Environment, Energy, policy and grant programs and things like that. But today I'm going to focus on source water protection and water quality health. So I'm going to begin talking pretty generally about about Nebraska's drinking water. You guys may have heard some of these statistics and stuff before, but so Nebraska is really blessed with groundwater. 85% of us drink from groundwater. We have the aquifer that covers most of our state. So 80% of Nebraskans drink from the community water systems, so drinking within city limits, compared to 20% of us drink from private domestic wells. So those folks who live outside city limits, 1 in 5 people, that's still a pretty high number compared to other states. And again, that's 100% and nearly 100% of rural residents. So there's really 2 ways that groundwater can be contaminated. And we can put that into point source contamination and non-point source contamination. And so this diagram, I think this diagram does a pretty good job at explaining the 2. So point source contamination is like this waste treatment plant right here. So you can see and trace back to exactly where the contamination is coming from. And so when you're having point source contamination, it's relatively an easy fix. You can go to the factory and be like, you're pumping this pollution into our water, please fix it. But non-point source contamination is a lot more complicated. And when we're talking about nitrogen or fertilizer and pesticide use, we're usually talking about non-point source contamination. And so as you can see, there are multiple things that are adding to the contamination of the water. So this is a lot more difficult to fix and a big problem, and something we're trying to tackle in Nebraska is non-source contamination. So a few factors that can influence groundwater contamination. So heavy rainfall, rainstorm events, irrigation, so potentially over-irrigation or irrigating at not the best times, like before a big rainstorm or something like that. So the movement of water is a lot quicker. Fertilizer, pesticide applications, so potentially we're not using the best fertilizing practices or fertilizing before a big rainstorm event. The depth of the water table or well, so if your water table is deeper, it's more difficult for the contaminants to move through all the soil and through the vadose and all of that to reach your water table. That also goes along with your well. So if you have a deeper well, it's more difficult for the contaminants to get all the way down through that water to that water. And then of course soil tape. So we know that sandier soils, water can move more quickly through them. Similarly with the contaminants, compared to clay soils or those thicker soils, water and contaminants move slower. It's more difficult for them to move through those soils. So when I was first entering this field of water quality and nitrogen use in agriculture, things like that, I was curious to why are we always talking about nitrate? Why aren't we talking about atrazine or other contaminants? The conversation is nitrate. And now I know there's a few reasons for that. In Nebraska, we use a lot of nitrogen fertilizers because of our agricultural practices. We have a lot of row crop agriculture, a lot of corn that uses a lot of nitrogen, grows well with a lot of nitrogen, increases the yield with nitrogen. And so of course we want to use it on our crops. And it is the main contributor though to the nitrate contamination in our groundwater. There's data from UNL that has shown that compared to animal and human waste. Sometimes people are like, oh, it's not just farming. And that's right, it's not just farming. There are other contributors, but they're definitely not as big as our fertilizer use in Nebraska. The other big reason why we talk about nitrate so much is because we have the data of the health concerns or the health impacts. So unlike atrazine or some other pesticides or other contaminants, even like uranium and things like that, we don't have as strong of data on the health impacts as we do as nitrate. And I'll get into that in a little bit later. And so these agricultural areas where there's a lot of fertilizer use, a lot of crops growing, they're at the highest risk for their nitrate or their groundwater to be contaminated with nitrate. And private well owners are at major risk for drinking this water, this nitrate contaminated water, because of their proximity to farms, because they're closer to the agriculture. And then on these private wells, which rural folks are usually drinking from, there is no required testing or treatment of those private wells. So I wanted to throw this graph in here. A lot of you, whoever's in the NRD, a lot of you guys have done a lot of testing to contribute to this map. But around 20,000 wells were sampled over this 20-year period, 2018, that were measuring nitrate levels. And so as you can see, I wanted to throw this in because it really emphasizes the nitrate contamination issues we have in Nebraska. So definitely in Northeast Nebraska, we see some reds and yellows, which are greater than 20 parts per billion, which is definitely not safe to be drinking. And then also along the Platte River Valley, as well as some other red and oranges speckled throughout the state. But these two areas are definitely of concern, especially like if you're trying to drink this water. So the current regulatory limit for safe drinking water is 10 parts per billion. And so this was set, this regulatory limit was set in 1992, but this really came back, and the grounds for this limit is from something called blue baby syndrome or methemoglobinemia, which is a blood oxygen transport disease. And so there was this healthcare provider, a doctor in Iowa City, his name was Hunter Conley, and he had some patients come in, and they're some women, some mothers, and they bring in their infants, and they had blue baby syndrome. And he was like, "What's going on? Like, what is this commonality between these women?" And he realized that these babies that had blue baby syndrome were bottle fed. So he was the first one that's like, maybe we should test the water that their formula is being mixed with. And so this happened in 1945. And they found out all the women brought in those babies that were drinking the formula mixed with really, really high nitrate water, like 45 parts per million. And so this was really the first time that we put together drinking nitrate contaminated water has real health impacts in the States all the way back to 1945. But it took a while to get that limit set in 1992. It's important to note that this is an EPA regulation, and it's only for public water systems. So the private well users out in the country in rural areas, they're not required to test or treat their wells. It's up to the well owner to do that. And that can be pretty costly to treat. So I'm going to get into water quality and health. And I do like to preface this that I know this is a controversial subject. Sometimes there's been a lot of news and different articles and stuff like that on this topic. But my purpose here today is to show you guys the research that we do have in the most transparent and straightforward and non-biased way possible. So I'm going to start out by talking about environmental health. So when we talk about environmental health, we are really trying to understand how do the ways that humans interact with our environment impact our health. So this is more important than you may think. The World Health Organization did a study, I think in 2016, and they found that 24% of all deaths across the whole world could be attributed to someone's environment. So that's a pretty high number. 1 in 4, almost 1 in 4 people die from your environment. So whether that's exposure to toxic chemicals, whether that's air pollution, potentially like an asthma attack, or extreme heat and heat stroke, we really need to be aware of our interactions with our environment and how they're really impacting us, because then we can start having interventions. So whether that's policy development or new technologies or whatever, we can try to reduce those mortalities or any health impacts. And that's what we're trying to do with drinking water right now. So starting with some human research. So as I just mentioned, we have the current regulation is 10 parts per million, and that was set in direct relationship with blue baby syndrome. But since then, there have been continuous studies trying to understand the relationship between drinking nitrate contaminated water and health. And a lot of this research has been taking place at the University of Nebraska Medical Center, but also across the entire entire world. This isn't just a Nebraska problem. This is happening in a lot of places in a lot of countries. And so drinking water with high nitrates has been linked to adverse health outcomes that are even below the legal limit. And I'm not going to get quite into that. I can get very detailed, but I do want to mention that we have 10 parts per million as a current regulation, but folks saying that this isn't enough, potentially, that we need to lower that. And we don't have an exact number in there. There needs to be some more research done, but there have been studies so far that have shown health impacts like 5 parts per million regulation limit. So the strongest linked health impacts are blue baby syndrome, pediatric brain tumors, thyroid disease, colorectal cancer, miscarriages, and birth defects. So there have been minor health ailments such as increased heart rate, nausea, headaches, and abdominal cramps. And then cancer is potentially associated in adult health, colorectal cancer, thyroid disease, kidney cancer, bladder cancer, and non-Hodgkin's lymphoma. And so I want to pause right here a little bit and talk about cancer because we're going to talk about it moving forward too. So starting from the farmer putting nitrogen fertilizer on their crops. So eventually the nitrogen fertilizer will break down by different things like soil, water, and microorganisms, and then it will create something called nitrate. And so this nitrate is what seeps into the groundwater, and that's what we consume when we drink the water. We are consuming something called nitrate. But we have bacteria in our mouths. So like when we swallow that water or we have it in our mouth, it breaks down the nitrate. And if this is confusing, please stop me because it gets kind of, it gets a little sciencey. So I just want everyone to understand. I want everyone to understand. So the bacteria in our mouth will break down the nitrate and turn it into something nitrite, and that loses an oxygen molecule. So then it competes with the other oxygen to bind to the hemoglobin in the blood. And that's how we came up with blue baby syndrome. We know that the more nitrate, the less oxygen your blood can carry because it's competing to bind with that hemoglobin. And because we know that bacteria in our mouths convert nitrate to nitrite, it can also do something else. The nitrite can, when we swallow that water, can react with different acids in our stomach to form something called N-nitroso compound. Okay, so you might be like, what's an N-nitroso compound? Well, nitroso compounds are known carcinogenic, which means they're known to potentially cause cancer. And also a teratogen, which impacts the embryo. It impacts the embryo can cause birth defects in mothers. But I do want to note that these studies have only been done on animals, so we can't say that a nitroso compound is a carcinogenic for humans. We don't know that right now. But we do know that the nitroso compound can induce cancer in about 50 different animal species, including higher primates. So those higher primates are things that are close to us. And from that data and from those research projects, there's supporting cancer evidence for brain tumors, gastric cancer, colorectal cancer, pediatric cancer. So a lot of different cancers have been reduced from these studies, and you'll see that these cancers that were associated as well. So just knowing that, I wanted to put that out there. Some of this more sciencey stuff, it's sometimes a little complicated to understand, but to explain, but that's the association with cancer, or like what we're looking at, isn't just something completely random. There is some data and some research that's been really trying to understand. And also want to note that we can't do these tests on humans because that's another goal. We can't just so compound and see if they get cancer. So it's limited to human. Other potentially related diseases, Alzheimer's, diabetes, and Parkinson's disease. So I got this from the Center directly. It's understudied right now. They're originally seeing some associations with these diseases, but they definitely need to be studied a lot more before we would say any strong associations. And then maternal, fetal, and health issues. So this is a big concern of ours too when we're talking about water quality and health. So miscarriages, preterm births, fetal growth restrictions, and birth defects. And I could talk about all of these, but for the sake of time, I just wanted to talk about birth defects in Nebraska. So the national rate of birth defects is 3.3% of all live births. In Nebraska, we almost doubled that average, averaging 5.8%. And so this map, the darker purples represent the counties in Nebraska that have a higher rate of birth defects. And sorry, that's a little blurry, but some counties in Nebraska almost quadruple the national average. So that's an interesting correlation we're seeing as well. And you can see in the eastern part of the state, though in the western part of the state as well, we have some pretty high rates of birth defects, and the concentration is interesting that it's in the eastern part of the state as well. And so there was a study done in Nebraska. Some of you guys may know her. She's the researcher who does a lot of this right at UNL. So she found with some of her colleagues that counties with higher birth defects had greater prevalence in water. So this was simply looking at this data from the Department of Health and Human Services on birth defects and also testing wells. Putting it together and seeing the comparisons between the two. Again, it's not causation. This is just a comparison. It's something that they came up with. They saw a strongest association for when they found both nitrate and atrazine in the water rather than specific contaminant alone. So moving into the health issues in children research. So as I mentioned, we have methemoglobinemia or blue baby syndrome. We also have pediatric cancers, which I'll get into in the next few slides. And then also a concern is non-Hodgkin's lymphoma, which was Martha Rhodes and some of her colleagues found an increased risk with both nitrate and atrazine in her Nebraska study as well. Okay, so I wanted to put this slide out here to display the rate of cancer in our state right here in Nebraska. So as you can see, the national average is 173.7 per 1 million is the rate of childhood cancer in the entire US. And Nebraska ranks 7th at 183.2. And you can see in the middle, we're the dark blue, and we're the highest rate of pediatric cancer in all of the Midwest as well. So in the Midwest region, the average rate is 172.9, in Nebraska is 183.2. So that's definitely a concern. And so this map, so the top map shows all pediatric cancer in the incidence of pediatric cancer in all counties in Nebraska, and the bottom is specifically to brain tumors. And so the orange and red are counties that exceed the statewide incidence. So as I just mentioned, we have a high statewide incidence as it is, higher than most states. But the orange and red are counties that have even higher than our statewide incidence. So, and I also want to point out these gray counties, they didn't have enough cases to even come up with an incidence. So in the top one, you can kind of see that our pediatric cancer isn't necessarily concentrated anywhere. It's spread out across the whole state, potentially more in the southern, but we also have some in northeast Nebraska. But if we look at pediatric brain tumors, we can see a lot of Nebraska doesn't have enough cases to even have an incidence rate. But over on the eastern part of the state, we have a high concentration of red and mostly red, but some orange counties as well, which again are above the statewide incidence for pediatric brain tumors. And so to go into this a little bit more, the researchers at UNMC wanted to look at this instead of by county, look at it by watershed. And so these A, B, and C represent different types of cancer. So A is central nervous system tumors, B is leukemia, C is lymphoma, and then this D represents is a map of the land use in Nebraska. So the pink represents that type of cancer that is above the national average in that watershed. And so for A, which was central nervous system tumors, you can see that we have a lot of watersheds that have above the national average, specifically in the eastern part of the state. B definitely not nearly as centralized or concentrated as A. And similarly with C, it's kind of spread out across the state. And then D, we're looking at the type of crop being grown. Green is corn, and we have a lot of the corn being grown on the eastern part of the state. So I do want to note and be very clear that with the research that we have right now, we do not use the word causation. We cannot say that just because corn is being grown in the eastern part of the state, that's the reason that we have CNS tumors in the eastern part of the state. The data is not there. We can't say that. We're just looking at the correlations. We're putting together some of the other data and science that we have to look at these correlations and potentially see what's happening. But we don't have the data to say this is an exact causation. And so from the science and stuff that I just went through, these are our most vulnerable populations that we're interested in. So pregnant women and their fetus, young infants with the blue baby syndrome, children with pediatric brain cancer and pediatric cancers, and then individuals with oxygen transport issues. So as I was saying earlier, with the blue baby syndrome and the blood oxygen transfer, that also isn't just specifically to babies. It can happen if an adult has an oxygen transport issue as well. And I wanted to mention these two other contaminants. People ask about these a lot, and just wanted to put the science and talk about it that we do have. So atrazine, there's definitely not as much data. There's very limited data on the health impacts of atrazine. This example was on the CDC website of a study finding that it impacts the reproductive system. So some researchers were studying couples living on farms. I think it was in southern part of the US. But they were studying couples living on farms that were using atrazine for weed control, and they did find an increase in the risk of preterm delivery, so having their baby early. But this was difficult to interpret. We can't say that it was definitely related to atrazine because who knows what else they were exposed to. Potentially a different type of pesticide could be causing this, but this was a study done trying to understand health impacts on atrazine. And of course, similarly to what I was saying earlier about the N-nitroso compounds, because of like being ethical in your research, you can't just expose someone to atrazine and see what the health impacts are. It's more complicated. So this was like an observation of what's going on. There have been animal studies done on atrazine, and they have found there have been a lot of animal studies on atrazine, and they have found changes in blood hormone levels that have affected the ability for those animals to reproduce. They have also found that atrazine has caused liver, kidney, and heart damages to various types of animals. But again, important to note that animals can be impacted a lot differently than humans can be. And PFAS. So I don't know how much of the audience has heard of PFAS, probably quite a few of you guys. They call it the forever chemical. It's kind of alarmist, but so this is a chemical, in case you guys don't know, some of you don't know, this is a chemical that's been used since the 1940s because of its resistance. Well, PFAS is the broader term. There are different types of chemicals underneath, but this type of chemical has been used because of its resistance to grease, oil, water, and heat. And so, for example, they started using this chemical in staining water-resistant fabrics, carpets, cleaning products, paints, firefighting foams. And they have seen that when they draw your blood and they can look at it through your blood, that folks have PFAS in their blood, humans do. And so the research is somewhat limited. There's enough research to create a new maximum contaminant level, which I'll get to in a second. But some of the potential health impacts and the research that has been done has found that there have been some reproductive impacts, developmental effects, increased risks of cancer, reduced ability for the body's immune system, interference with natural hormones, and increased cholesterol and risk of obesity. Again, these are potential health impacts, no causation type of thing yet, but this is the research that's been ongoing, potentially some of the health impacts, and it raised enough concern for the EPA to recently, just March 14th, 2023, so literally like 2 or 3 weeks ago, to create a maximum contaminant level that SID public water systems will have to abide by. So sometimes this conversation can be a little negative and like feeling a little helpless. So I like to just throw this slide in here to talk about like what can you do right now, tonight, if you're worried about it, how can you address your exposure? So one thing that we recommend is annual testing for whatever you're concerned about, nitrate, bacteria, other PFAS, or well, PFAS is hard to test for, but different, whatever you're concerned about. And it's important to note that nitrate doesn't have an odor, you can't smell it, you can't taste it, you can't see it. So the only way you're gonna know if you have nitrate in your water is to test it. And there are a couple different types of tests. You can do like a dip test, which is some public health departments, some entities offer the dip test for free. It's just you get a sample of your water, you dip it in, and then it has like a color scale, which will show you like the amount of nitrate. But we say that's mostly just a screening tool. So if your dip strip test says like 10 and it's in the red, okay, then you need to probably get a certified lab test and take this a little bit more seriously because your water is high. So the other option is to get a certified lab testing kit, which you can get from the state, or you can get from a local lab. And that's a little bit more complicated. It's not super difficult, but the results will be more official. So if your nitrate tests high, there are a few things you can do. You can put in a reverse osmosis system. You can use like a whole house system or a point of use. And there is some funding available right now for the state, which I'll talk about in just a second, to help private well owners with the cost of reverse osmosis systems. But there are also other systems, ion exchange systems, or finding an alternative drinking source. So you went home tonight, your water tested really high, then we would say like go get bottled water or something like that. But then we could also, when we're saying alternative drinking source, potentially finding a different well, digging a deeper well. Obviously, those are costly and not a big deal. And things that do not remove nitrate. So I get this question a lot. If I have like a Brita or a filter on the fridge, will that remove my nitrate? And it won't. Carbon filters won't remove it. Boiling water doesn't remove your nitrate. Your best bet is to get a reverse osmosis system. Probably you can do whatever you want, but I would recommend probably getting a reverse osmosis system put on your faucet. So I'll talk about this just very briefly. So right now there's some funding through the Nebraska Department of Environment and Energy, and I have some flyers back there if you're interested. Well, I can double check over lunch to get this information, but my understanding is, I'll just go through it pretty briefly then, is that so if you have a private well and you want to get an RO system, there's a rebate program, so you have to have the upfront cost of paying for it, but you fill out an application, your well has to be registered, you would test it, you have to get a test from the state lab, order that test, send it in, it has to test high for nitrate, over 10 parts per million. And then you get pretty much your application gets ranked and the state will start giving that funding out. A little bit more complicated, there are a ton of details. Obviously, if you can see all these QR codes, there's a lot going on with this policy and this rebate program. But yeah, my understanding was that it opened early January and the applications were being accepted since then. And the first review was going to take place March 31st. And they were expecting to get a lot of applications right away, thinking the funding was going to go quickly. But because of the complexities of this application, there hasn't been as many applications. So the funding hasn't gone as quickly as they expected. And so the official deadline, which I was pretty sure is written into the policy, but I think I will check, that this application will close next summer. So the funding potentially is still available for folks to apply for, but again, this is for private well owners and they want us to testify for nitrate. Specifically focused on nitrate. Yeah, so like I said, you have to use a state lab kit to test your well. And so there's a QR code that will lead you to the state lab website and to order a kit. You need to have your well registered, so that's been a barrier and a hindrance to some people getting applying. So you can check with, I think it's DNR. DNR does that. And then the one below that is how to register your well. And then the other QR code is just for more details on the program. Like I said, it's pretty complicated. And then the one over on the left is the actual application for the rebate program. And again, you get up to $4,000 reimbursed. So you have to do the upfront cost of the testing and all that stuff, but you can potentially get that money back. Okay, so that's kind of that's all I have kind of to say about water quality and health. If you're interested in this topic, feel free to talk to me. I work with the Water Climate Health Program at UNMC, and they do a lot of this research, so can point you guys to them. I can try to answer whatever questions you have for me, but this conversation needs to continue, and people need to keep talking about it. And I do want to mention, I did mention this right after Dan's talk, but we do have these source water protection grants that we really would want folks to apply for. And they're focused on source water, which is any water below or the surface for drinking water. And so these grant requests for proposals were just sent out, as I said earlier, in February. They're due in June, I think Tatiana said. And then the projects are set to begin late fall. So again, if you have questions, let me know. There's a QR code on the paper if you check that out. There's specific eligibilities. The political subdivision has to be less than 10,000 people. Things like that. You have to display financial hardship or a need, I guess, for this grant. But yeah, we really encourage you guys to apply. All right.